Hello and welcome back to Path to Nursing. Are you preparing for the NCLEX-RN? In today's video, we'll test your knowledge of fetal heart rate monitoring and interpretation, one of the most important OB topics on the NCLEX. You'll answer 10 original NCLEX-style questions, including a bonus SATA challenge. Pause the video before each answer, make your choice, and stay for the rationale to strengthen your clinical judgment. Ready? Let's see if you can score 10 out of 10. Question 1. A nurse is assessing the fetal heart rate of a laboring client. Which baseline fetal heart rate is considered normal? A. 90 beats/min. B. 110 beats/min. C. 140 beats/min. D. 170 beats/min. Correct answer, C. 140 beats/min. Rationale: a normal baseline fetal heart rate ranges from 110 to 160 beats/min. A rate of 140 beats/min is within the expected range. Question 2. Which fetal heart rate characteristic indicates adequate fetal oxygenation and a healthy autonomic nervous system? A. Late decelerations. B. Minimal variability. C. Moderate variability. D. Variable decelerations. Correct answer, C. Moderate variability. Rationale: moderate variability is a reassuring sign that the fetus is well oxygenated and neurologically intact. Question 3. The nurse notes fetal heart rate accelerations during labor. What is the best interpretation? A. Fetal distress. B. Normal fetal well-being. C. Umbilical cord compression. D. Placental insufficiency. Correct answer, B. Normal fetal well-being. Rationale: accelerations are reassuring and indicate adequate oxygenation. Question 4. The fetal monitor shows early decelerations during contractions. What is the most likely cause? A. Umbilical cord compression. B. Fetal head compression. C. Placental insufficiency. D. Maternal hypotension. Correct answer, B. Fetal head compression. Rationale: early decelerations are caused by fetal head compression and are generally considered benign during labor. Question 5. The nurse observes a fetal heart rate baseline of 170 beats/min for 15 minutes. How should this finding be documented? A. Bradycardia. B. Tachycardia. C. Moderate variability. D. Early deceleration. Correct answer, B. Tachycardia. Rationale: a sustained fetal heart rate above 160 beats/min is classified as fetal tachycardia. Question 6. Which intervention should the nurse perform first when recurrent late decelerations are observed? A. Reposition the client to the left side. B. Encourage ambulation. C. Increase oxytocin infusion. D. Place the client in the supine position. Correct answer, A. Reposition the client to the left side. Rationale: repositioning improves uteroplacental blood flow and is one of the first nursing interventions for late decelerations. Question 7. Variable decelerations are most commonly caused by A. Maternal hypertension. B. Umbilical cord compression. C. Fetal head compression. D. Placental aging. Correct answer, B. Umbilical cord compression. Rationale: variable decelerations are abrupt decreases in fetal heart rate typically caused by compression of the umbilical cord. Question 8. A nurse is reviewing a fetal heart tracing that shows moderate variability with occasional accelerations and no decelerations. What is the priority nursing action? A. Continue routine monitoring. B. Notify the healthcare provider immediately. C. Prepare for an emergency cesarean birth. D. Administer oxygen. Correct answer, A. Continue routine monitoring. Rationale: this tracing is reassuring and requires no immediate intervention beyond routine monitoring. Question 9. Which finding is most concerning during fetal heart rate monitoring? A. Baseline of 145 beats/min. B. Moderate variability. C. Recurrent late decelerations. D.2 accelerations within 20 minutes. Correct answer, C. Recurrent late decelerations. Rationale: recurrent late decelerations may indicate uteroplacental insufficiency and fetal hypoxia, requiring prompt evaluation and intervention. Question 10, bonus SATA. A laboring client develops recurrent variable decelerations. Which nursing interventions are appropriate? Select all that apply. A. Reposition the client. B. Assess for umbilical cord compression. C. Administer oxygen as prescribed. D. Increase the oxytocin infusion. E. Notify the healthcare provider if decelerations persist. Correct answers, A, B, C, E. Rationale: A. Repositioning may relieve cord compression. B. Variable decelerations are commonly associated with umbilical cord compression. C. Oxygen may be used if indicated to improve maternal oxygenation. D. Increasing oxytocin can worsen fetal stress by increasing uterine contractions. E. Persistent variable deceleration should be reported for further evaluation. Turn on the notification bell so you never miss a new NCLEX practice session.